going to talk to you about hepatitis A, B, C, and D viral infections. So our objectives today, understanding each viral hepatitis infection, A, B, C, and D, the clinical manifestations that you might be seeing with your patients who could possibly have these viral infections, when and what patients to order hepatitis screening for, and understanding the lab values associated with each viral hepatitis, and knowing between acute and chronic infection. So some lab values that might be an indication that there is a hepatitis infection, and when you would want to order the hepatitis panel. So the liver enzymes, if they are elevated, can be seen up to 20 times the normal value. This occurs because of damage to hepatocytes. Bilirubin, if it's higher than 20, that would indicate how severe the disease is, and elevation of this can be seen as jaundice in patients in your assessment findings. The CBC might indicate some mild leukopenia with some abnormal lymphocytes, anemia, and low platelet counts could also be noted. So, hepatitis A, that is the first one we will go over. That is spread via close person contact, whether that be with food, water, or IV drug use. Some symptoms that patients might be reporting, or you can see, jaundice of the skin or eyes, fever, nausea, vomiting, joint pain, fatigue, dark urine, and light-colored stools. People who are at higher risk of infection include homeless populations, international travelers, IV drug users, and possible exposures at work, whether that be healthcare or daycare workers, if they were taking care of somebody who did have a hepatitis A infection. Vaccination is recommended during routine childhood vaccinations, but can be given to adults. And these are 2 vaccinations given within a 6-month period. So the hepatitis testing, the anti-hepatitis A virus IgM, so that means having antibodies to hepatitis A virus, indication of acute or recent infection. IgM usually appears within 3 to 4 weeks, and it clears within 8 weeks. IgG antibodies, indication of a previous infection or post-vaccination immunity. The IgG antibodies, remember, those stick around in the body longer. IgM shows up first. The IgG will rise approximately 2 weeks after infection, and if IgM is present without IgG, suspect an acute infection. All right, moving on to hepatitis B. Bloodborne transmission can be spread via drug use, sex, childbirth. Symptoms are the same as hepatitis A. Vaccination is the best prevention, 3 injections within a 6-month period. Vaccination is recommended for all infants. So acute versus chronic infection. Acute, the body clears the infection within 6 months. No long-term side effects, damage to the liver. Symptoms can range from none to serious, and immunity will occur after the infection clears. Chronic, the body does not clear the infection, and this only happens about 5% of the time. All right, so testing for hepatitis B. Hepatitis B virus surface antigen indicates that the patient is infectious. Hepatitis B virus E antigen indicates viral replication is occurring and it's very infectious. Antibody to the surface antigen indicates the infection was self-limited, or this is post-vaccination. So this would indicate that the patient does have immunity against hepatitis B virus. Antibody to the surface antigen indicates low risk of transmission. Sometimes will be positive in an acute hepatitis B infection, but will be positive in chronic infections before seroconversion occurs. Antibody to the core antigen indicates could be a new or chronic infection. IgG, this will be apparent on the onset of acute symptoms and persist through life. This will not occur with vaccinations. The hepatitis B surface antigen is the easiest and most frequently ordered. It's the first lab value to indicate an infection, and if this persists with the patient is considered a carrier and to have chronic hepatitis B virus. Who should be screened for hepatitis B? Pregnant women one time during pregnancy, babies born with a hepatitis B positive mother, patients with HIV, history of IV drug use, whether that be just a couple of times or a patient who does report that they currently are using IV drugs. Patients with end-stage renal disease, including hemodialysis, elevated ALT with an unknown cause, and people who are not vaccinated against hepatitis B but reside in an area with high prevalence. Okay, moving on to hepatitis C. This is also transmitted via bodily fluids, just like hepatitis B. Symptoms usually develop within 2 to 12 weeks, but can take up to 6 months. Symptoms are the same as hepatitis A and B virus. 50% of people are not able to clear this infection and will need treatment to prevent liver damage. There is no vaccine against hepatitis C, but there are antiviral medications. Treatment usually lasts between 8 and 12 weeks for the antivirals. People can live for years with no symptoms until they're having symptoms of chronic liver disease. Alright, so testing for hepatitis C. The antibody does not provide immunity but does indicate that there has been a hepatitis C infection. Does not determine whether that is acute or chronic, and it just indicates that they've had an infection. Remember, there is no vaccination for hepatitis C, so if they're having antibodies, they have had an infection sometime in their life. The antibodies usually will develop within 12 weeks of infection, and if patient is positive for the hepatitis C virus antibodies, genotyping will need to be initiated to figure out whether this is an acute or chronic infection, and so you know how to treat the patient appropriately. So here's a link to a little decision tree from the CDC. Let's see if it'll work. Perfect. Okay. So you can kind of, it's not showing up here. I will link the PowerPoint so you guys can see this decision tree. Let's go back to the PowerPoint. Okay, so who to screen for hepatitis C virus? People who have received an organ transplant or any blood products before 1992, any patients who report any current or past IV drug use, elevated ALT or hemodialysis patients, children who are born to a mother with a known hepatitis infection, patients with HIV, and routine screening should be offered to patients who do report IV drug use and engage in high-risk sexual practices. A healthcare worker, if they do receive a needle stick from a known hepatitis C patient. And then one-time testing should be offered to all patients who are born in the baby boomer generation. All right, so moving on to hepatitis D. This can only occur if the patient has a hepatitis B infection, transmitted the same way hepatitis B is, via body fluids. All right, so testing for hepatitis D. IgM, this will be positive in acute infections and occurs in high proportions of chronic hepatitis B infections. IgG antibodies, this exists even after infection is cleared and will always be positive in patients who have had hepatitis D in the past. Who should be screened or you should order the hepatitis D testing for if a patient does have a known hepatitis B infection, and usually it is transmitted through sexual activity. And these are a copy of the references, and like I said, I will go back and link that decision tree for the hepatitis C. It goes into when to order the screenings, so you know when to treat with medications, whether it's a chronic or an acute infection. Thank you.